Hi, I'm Gary White for Channel 6 Central Kentucky Television. I'm here for our Political Focus program here on Channel 6, where we give our viewers the opportunity to know the individuals who are running for office this year in the general election, which will take place on November the 6th. And today I'm here with Barry Brady,
Yes.
who is Marion County Jailer, and he will be on the ballot as Marion County Jailer again. What term will this be?
This will be going into my 5th term.
Okay.
Yeah.
And there will be an opponent on there too, so we're giving everybody the opportunity to get to know the people who will be on the ballot. Tell us, Barry, why are you choosing to run for jailer another term?
Well, I'm still quite young, Gary. I'm 56 years old, and I'm on of course the jail staff, and we're all on the 27-year retirement plan, non-hazardous. So I've only realistically got 15.9 years in on the retirement, but even though I have some years in corrections, a lot of my first 16 years was in the private sector, which has no effect at all on the government retirement. So first and foremost, this is I'm still too young for retirement, too young for Social Security, and it's the passion. I mean, Gary, this is a job that it's not a job; it's a career, and I love coming to work. But we make a difference, and I think that's the biggest thing I get out of it. It's making a difference in these folks' lives, and I'm honored to serve the folks of Marion County in this position.
Tell us, what are the job duties of the jailer?
Well, you're the chief administrator, overseeing the operation, and this is quite the industry. I mean, we're 297 beds. We got contracts with the U.S. military, the U.S. Marshals, as well as the state, and Washington County, and that we stay at capacity, or sometimes a lot of times past capacity. But so the administrative duties is not only we're overseeing the jail financially, responsibly, efficiently with the budgets and stuff. At the same time, making sure that we're coaching our staffs, doing the right thing as far as programs. One of the things I guess that if I had something to say, that it was very proud of what we've accomplished already with this administration, is the fact of it is that Marion County leads all other county jails in the amount of programs. We are the largest programmatic jail in the state of Kentucky, and it's it's a lot to hang your hat on, but it's what we're accomplishing with it, Gary. I mean, when we're seeing results, and there's times that you don't get the result you necessarily want, because addiction has, it's the clutches of addiction is horrible, and that's one thing that the staff and myself, everybody has come to realize in this, and we know that we got to do more. We got to do more.
So what would you say you're most proud of over your tenure so far as jailer here at Marion County?
Well, so far is, our professional accomplishments. Again, we lead in the state on the amount of programmatic beds that we offer, the individuals that we've helped over the years, and we're the only jail in the state of Kentucky, the first jail in the state of Kentucky to go for national standards in 2010, when the American Correction Association developed the core standards for jails. We sought after that, achieved that goal, and we led that. And we're working still with the state, because we let that accreditation slide back, money cost, and some issues with that. But every prison that we have in the state of Kentucky is accredited under American Correction Association, and none of the jails. I think we do have one of the metropolitan jails. I think Louisville may have recently regained a title with that. So
what would you say are the challenges that are currently being dealt with, but also what you see if you are to continue as jailer?
Well, the first and foremost is what the state pays us when they pay the county, because right now all Class D felons by state law are required to be housed in county jails. Years ago in the 80s, when the state had the dissent decree and some issues come down regarding overcrowding in prisons and stuff, and the feds come in and was going to fine the state if they didn't come into compliance. Well, the dissent decree was issued in about 1983, and so the state didn't really have the revenue to build prisons or jails, and that was actually the birth of about the time that privatization got its start and stuff in it. But then they reached out to county jails about adding on, and the law then allowed by just saying that a Class D felon may be housed in county jail. And that went all up into the 90s, and then they changed the word from may to shall. So now today there's 12,000 men that are in the Class D level type program that are housed in jails, men and women. So that per diem, they've set a per diem for the counties to be reimbursed for those housing, and that has, as our years have gone past, the cost of incarceration is soaring with our medical issues, mental health, with the drug addictions, the contagious diseases, and so forth. So the primary issue that we must fight for in the upcoming year, and that is to get the state to adjust that per diem to a more reasonable, practical per diem reimbursement for this housing, and make it more in line with what's going on with the prisons. Right now, Gary, we're paid, county jails are reimbursed $31.34 per inmate. Well, the cost of housing a prisoner, just for say at North Point Correctional Center there, or Point in Danville, the prison, is probably $65 a day. So that's a long stretch from 31. Now, however, on my programs, I get a stipend on those, which is $9 on for the program beds that we do. So we average around $40 a day, but it still doesn't meet the needs and demands of what the cost is on our county and across the state. So that's the primary, is that we've got to continue to work with legislators and work with the Secretary of Justice and them to get that per diem adjusted to fit what services we're providing.
So I think a lot of viewers may not be aware that actually lobbying or government interaction is a big part of your job duties as
yeah, I have. I've had the pleasure and to go testify in front of a joint sessions at Frankfurt, and that's part of it. That is when we elect county officials. It's not just that office or that job down on 201 Warehouse Road in the office, and that's what we do. It's day in, day out. You're in your job element, and so that's what again makes it so valuable. And what I can bring to the table, and what I have been able to bring to the table, is my networking skills, my involvement from all three levels of government, from the federal, state, and local government, but interacting with the Secretary of Justice, Department of Corrections, and then I've been called upon by 3 different governors already that I've served under. Actually served under 4. I've been called upon by 3 of them to assist in the evolvement and movement of jails and what we do with them. Kind of like the recovery, the recovery centers and stuff we talked about. I've been on those sound panels.
So the drug epidemic has had a big impact on the jail situation as well, correct?
Oh my gosh, yes it has. Gary, and so I'm over 15 years in as the county jailer, and even in that short of a period of time, what we dealt with back then to what we're dealing with now is off the radar scale. I don't know. The typical constituent probably really doesn't know the day in, day out of a correctional deputy or a counselor that works in the jail that deals with the individuals that we bring in to hold. But the contagious disease element is blown up. I mean, to think that years ago, if you had a possibility of HIV, you thought, well, but that's just a regular norm. Right now, I think I've got about 3 HIV cases, a multitude of hepatitis A, hepatitis C, diabetes, chronic care with hypertension. And our medical cost within the corrections is another thing that it's blowing up because of the drug epidemic, the drug addiction. The individuals we're seeing that coming in here today are in poor health, very poor health. And now to tab on with the poor health is the poor mental health. So and that'll be in the coming years that actually we're negotiating, working on medical contracts as we speak for the jail, and it's going to be considerably higher than what we've been accustomed to, but we must address the mental health because we are been inundated with, lots more mental health issues coming in the door, and you got to do right and service this issue.
So if you are reelected as jailer here in Marion County, what would you like to see 4 years from now when that term's over? What kind of changes or evolution would you like to see occur?
Well, first and foremost are a few things, and making sure that we get properly paid by the state, and making something more in line with what they're paying for the prisons and the opportunities of what we're offering the services. So bringing that pay up to where it needs to be at so that we can better stabilize our budget. But we've got to address, at the same time, we've got to address our staff retention. And Gary, when we're a mediocre, we're running $12 to $13 an hour to start. We have some employees have been here for 3 or 4 years. They're up $14, $15 an hour, but we're not able to hold them. The staff turnover and the opportunity for employment at other places to match that money is there. It's in our communities. It's here in Marion County. And to add to that case about the employees and retention is these employees are met daily with exposure to contagious diseases. When I say contagious diseases, when we talk about hepatitis, that stuff is coming through our doors, and we're the first responders. We're in those areas with that with the mental health. So it's a little bit harder. The stress level on the employees has changed. The standards have changed. The elements of type of inmates that we're seeing, the health conditions. So I hope that in the 4 years that we get the needed adjustment with the state per diem, that we can make the needed adjustments so that we can at least stabilize staff retention a little bit better than we have in the past year. And reentry. Gary, there's one thing that we need in this community. We're an industry community, a lot of factories and a lot of help needed out there. And so this reentry component will be where the individuals, prisoners that have worked their way through incarceration and they're nearing the end of their incarceration. So they will be, and they've completed some of the other substance abuse programs and the REACH program and stuff. So they're eligible to go into this reentry. The reentry will still be correctional supervision, but they'll be able to hold free world jobs. So it'll be similar to the halfway house type setting, but it'll be run by county government, and we're able to put them out across the state a little bit more into the areas where geographically where they're from or so forth. We'd hope so. So I would like to think that we could have 80 to 160 reentry beds here in Marion County, trying to maybe help with our workforce needs that we have here in our community. But the biggest thing is that we can help these individuals once they go through this treatment and programs, that we can help them stabilize their life with some additional work, training, education. And during this time, their work, they'll actually pay a portion of their Their incarceration will be paid from their salary earned. They'll pay restitution, child support while they're working, and then they'll be required to have a savings account. And something right now that we have so many that leave incarceration, and they're somewhat a burden, could be a burden, considered a burden to family and friends, because during their incarceration, the family is paying for phone calls and commissary and giving them a little bit of money along the way. And then when they get out of incarceration, then they're still right back at the same thing. We've got them at a point that they've been out of the work cycle for 18 months, 30 months, and they don't have any money to restart on. So they're back at either asking from money from their families or stuff, or they get entertained to go back into that to the illegal activities, and that's what we don't want them to do.
So why, for our viewers, what would you say makes you the most qualified individual for them to vote for on November 6th for Marion County Jailer?
Well, I'll go back to what I said earlier, and the 32 years of my experience in jails and stuff. I've got 23 years administrative experience and 15 plus years as your county jailer. And I have the networking skills, the knowledge to work all three levels of government, from federal, state, and local governments, and the ability to see what we need in the future and guide this. I know we've done a good job so far, and I'm excited about what tomorrow's going to bring, where we can take it.
Again, I'm talking with Brady, who is running for Marion County Jailer. The general election will be on November 6th. And any final words you'd like to offer for our viewers?
No, I greatly appreciate your vote this November the 6th for Barry Brady, Marion County Jailer.
This has been Gary White for Channel 6 Television's Political Focus.